Welcome to my channel. If you are new, thanks for visiting. If you are a returning user, I just want to say thanks for sticking around. Today we are going to address the types of advanced practice registered nurses in the United States. There are 4 types of advanced practice registered nurses. I'm going to go into the details of each of them and let you know which one is the most in the United States and how you can get into one of these professions. So let's dive right in. Before I do that, if you are new to my channel, I'm Bez. I am a dual certified family psychiatric mental health nurse practitioner and I'm also a family nurse practitioner. So let's dive right in. First of all, like I said, there are 4 types of advanced practice registered nurses in the United States. Number 1, nurse practitioners. Number 2, certified nurse midwives or CNMs. You also have CRNAs or certified registered nurse anesthetist, and you have the last one, which is clinical nurse specialist or CNS. So these are 4 groups. Of all these 4 groups, the most populated in the United States at this time are nurse practitioners. So let's begin with nurse practitioners, which I am one of them, proud one of them, right? There are several types of nurse practitioners. There is the adult nurse practitioner. Someone with an adult nurse practitioner provide care that is catered to adults only, meaning they see patients between the ages of 18 and above. All right, so that's why they are called adult nurse practitioners. Nurse practitioners that are certified as adult nurse practitioners do not provide cares to minors and teenagers. They see patients anywhere from the ages of 18 and above, right? You also have what we call family nurse practitioners. Family, for the word family. In the family, what do you have? You have newborns, peds, 1 and over, 2 to 3, all of that, all the way till death. So family nurse practitioners are the broader category of nurse practitioners. These nurses that are certified as FNPs, or you want to call them family nurse practitioners, they provide care to patients from birth to death. Yes, they provide services from birth to death, so 0 to 100 plus, or however many years somebody is living, right? So these people, they provide a wide range of services to this age group. They provide care from primary care services from baby to death. They diagnose and treat patients of all ages, right? Some family nurse practitioners or FNPs do work in specialized settings. When they do work in the specialized settings, they only see patients that come for services in the setting that they work in. So if they work in a cardiovascular setting, they could see patients from birth to death and render cardiovascular services working with a cardiologist, right? The other group of nurse practitioners, we have pediatric nurse practitioners. Pediatric nurse practitioners only see pediatric patients. Who is a pediatric patient? A pediatric patient is a new baby all the way to age 17. New baby that's newly born all the way to age 17. So those are pediatric patients. When you turn 18, you become an adult. So pediatric nurse practitioners provide a wide range of services, primary care services, of course, to a pediatric population. Now you have what we call adult gerontology nurse practitioners, right? These are adult nurse practitioners that, or adult gerontology nurse practitioners, acute care NPs. These work with elderly population, adult and the elderly, right? Acute care nurse practitioners provide services in the inpatient setting. When you are admitted to the hospital, they work with you while you are in the hospital, and then when you are discharged, you follow up outpatient. So these are nurse practitioners that may work like hospitalists on call, and they rotate in the hospital setting like other family nurse practitioners and other physicians who are primary care and acute care do, right? And then there's another group of nurse practitioners. You have what we call emergency nurse practitioners. Emergency nurse practitioners go to school and they are certified to work in the emergency setting, like in the hospital setting. When you go in, you will see them in the hospital, in the ER or ED, seeing patients in this setting, and they see a wide range from kids to adulthood to elderly and all of that. So they see patients in the emergency room setting. Okay, you also have what we call psychiatric mental health nurse practitioners. Yes, psychiatric mental health nurse practitioners, which I am one of them. I'm also a psych NP and a family NP. See patients that seek behavioral health services from bipolar, schizophrenia, anxiety, depression, and a whole host of other diagnoses, right? They work in several settings. They can work in the outpatient setting, inpatient setting, right? Crisis unit, detox units, hospital setting. Yes, they can do consult on medical, surgical floors and admit to behavioral health units. They can work in the emergency room. So you have psychiatric nurse practitioners. And within the psychiatric nurse practitioner, you have what you call family psychiatric nurse practitioners. These are people that cater to patients of all ages, right? And then you have the adult psychiatric nurse practitioners or pediatric psychiatric nurse practitioners. That would just mean they cater to adults or they cater to pediatric patients. But those that are family psychiatric nurse practitioners see patients of all ages. And then you also have certified nurse midwives. These are the mother and babies, like you will consider them like the OBGYNs of nurse practitioners, right? They provide birth control services, they work in clinic and community health centers, they work in hospitals, they work with patients individually at home doing home birth, and they deliver babies low risk, like a pregnant woman who is pregnant but then the pregnancy is not high risk might follow up with a CNM, and they will deliver the pregnant woman and then send them to the other specialties. Yes, CNMs deliver babies, they provide birth control, they provide low risk pregnancy care. All right, and then you have CRNAs. CRNAs or certified registered nurse anesthetists. These people go to school and work to deliver anesthesia before or after care. They can put you to sleep, sedation before surgery, make sure you wake up safely, and all that. They work in inpatients, ambulatory care centers, surgical unit, outpatient surgical unit, dental offices, outpatient surgery centers, and a whole host of other facilities, right? But their job is primarily to administer anesthesia before surgical procedures, be it OBGYN, cardiovascular, whatever, and they also make sure that you wake up safely and they take care of you post anesthesia before you go home. So there's a wide range of advanced practice registered nurses, but among all these, the nurse practitioners are the ones that are most populated in the United States. You have a lot more nurse practitioners because, like I just mentioned, you have several subspecialties of nurse practitioners than you do CNMs, CRNAs, and clinical nurse specialists. Now let's talk about clinical nurse specialists. Clinical nurse specialists work in the inpatient setting, in the hospital setting. They provide a wide range of services in the advanced practice nurse role, right? So there you have it. All right. Now you ask me, how do I become one? What do I have to do if I want to become a nurse practitioner, a CRNA, a CNM, or clinical nurse specialist, CNS? You have to first of all become a registered nurse. That's the prerequisite for all these programs. You have to go to school, become a registered nurse first. Once you become a registered nurse first, the graduate programs have different requirements, but the school that I went to, you had to have practiced as a registered nurse for at least 2 years before you could apply to the advanced practice registered nurse program to become a family nurse practitioner. In my school, you had to take an entrance exam. You could take either the GRE or the MAT, Miller Analogy Test, right? So, and then you go to school for at least 2.5 years to 3 years to become a nurse practitioner after practicing as a registered nurse. Before I became one, I had worked as a registered nurse for almost 5 years. And then also deciding on what type of nurse practitioner you want to become might also depend on your background. For most, they pursue a career as an APRN that mirrors the role that they serve as a registered nurse. For example, before I became a family nurse practitioner, I had worked in several settings. I had worked in oncology, med surg, pediatric, psychiatry, inpatient, and outpatient. So when I became a family nurse practitioner, I had exposure in all these different settings. And then when I began working, I started working in psychiatry, meaning I was working as a family nurse practitioner providing psychiatric services. So I went back to school, got my postmasters as a psychiatric mental health nurse practitioner, because it is good when you have certification in the field that you provide care, patients are more comfortable and you feel more confident in the services that you provide. So I became a psychiatric mental health nurse practitioner. So now I am dual certified and I work mostly now with psychiatric patients, providing behavioral health services in a community health center. So your part depends on yourself, but then there are other requirements for other schools. You just have to talk with the school, see what the requirements are, and ensure that you meet those qualifications before you apply to become a nurse practitioner. For CRNAs or certified registered nurse anesthetists, they have to mostly work in the emergency room settings and ICU at least for 1 year before they apply to graduate school to become CRNAs. And the program length varies. It ranges anywhere from 18 months to 2 years for them to become CRNAs. And most of the specialties now do offer both MSN, which is a master's degree, as well as DNP, a doctoral degree in nursing. So I have a doctorate degree in nursing. And so yes, that's the process. You go to school, you finish your theory, and then you're going to do clinical rotations in the areas of the specialization. For me, I did clinical rotations for family practice. I followed a physician and sometimes a nurse practitioner for the duration of my clinical rotations. And I did a specialty rotation, I believe, in maybe psych, which is a requirement. Some schools require to do one specialty rotation for like 40 hours. Yes. So that's the route you would take to become one of these advanced practice registered nurses. So each one differ. Do your homework is what I encourage. If you want to get into one of these professions, just make sure you do your homework, speak to mentors, get somebody to mentor you, contact the schools of your interest and see what their requirements are. Ensure that you meet these requirements prior to applying to the school to increase your chances of getting accepted. Okay, so if you like this video, please give it a thumbs up. If you are not following me already, hit the subscribe button and follow me. If you have any questions, leave it in the comment section. I'll do my best to respond to them. Thank you.